breakthroughs. Speak among yourselves, speak with the experts. So now the next speaker is Dr. Catherine Lord, who is a clinician psychologist. No need to introduce her. She was the one who created ADOS, ADI, all these tools that are at the base of diagnosis. And she's also a person who has long longitudinal cohorts that for 30 years now, and she's going to tell us about, and I'm not going to talk about all her titles because she is a very powerful person, and she's going to talk about the major topics of this Université d'Automne, participative research, and the forgotten ones. So thank you, Professor.
It's very nice to be here. I was here, I think, almost 20 years ago, and I loved it so much, I'm back, you guys. So thank you very much for inviting me, and thank all the organizers and everything that went into this. I need my slides. So I am going to talk about profound autism, and I think what I want to do, you know what, we should hit good. The first thing I need to do, next slide please, is say I do have conflicts of interest because I do get royalties from the ADOS and ADI and SCQ. I'm not trying to sell you anything. And when they're related to something I'm related to, like anything in our own university, or we give the money to Have Dreams, which if you ever go to Chicago, is a wonderful wraparound program for people with autism. Okay, next slide. Oh, yeah, I didn't get this. Sorry, I was supposed to go pick that up, wasn't I? Oh, okay. Now it works. So that's it. I also have funding from a variety of different places, none of whom are responsible for what I'm saying. And I wanted to start just with a very general statement, which some of you might have heard me make before. But I do believe that autism is a difference that is present in most cases before babies are born, that is different about their neurobiological system, their brain function, that affects learning and how people take in information. It's a developmental disorder, meaning that it changes with development. It's not fixed. But also it affects development. And I think the example is that having autism, and I'm going to use mostly autism, but interchangeably with ASD, affects basic aspects of behavior, and in turn what children, for example, pay attention to, or how quickly they pay attention to something. I mean, I always think of a boy that when I worked in the hospital, used to go to school down the hall, and every day I would see him, I would say hi, and about 2 seconds later, after he'd passed me, he would say, "Hi, Dr. Lord," but it was just 2 seconds off. And I think some of that is related to autism. And it doesn't mean that people can't do things, but it does mean that the information base that they start with is different sometimes. They may have better information about some things than I do because they pay better attention to things, but they also pay less attention or just a second or two off of attention, and that means they get different information. I also think particularly for young autistic kids who may not talk yet, who have less facial expression, who don't yet use gestures, well, they give us less information, and in turn we behave differently. And I think you now know that there's a whole series of studies that show that most adults behave differently with autistic kids than neurotypical kids because of the kids, and it's not that parents make their kids autistic, it's that autistic kids produce different behavior in their parents, which often is very adaptive, but not always, but sometimes. And I put this slide up here because the girl on the right has classic autism. I mean, at 2, oh my goodness, she was filled with sensory, very strong feelings about being touched, about smells, about what she looked at, what she wanted to see, what she wanted to do. She has really quite strong nonverbal skills. She was better at doing puzzles than I ever was, but verbally was behind and does now talk. But she was lucky enough to be born to 2 parents who are absolutely committed to helping her, and she had 3 sisters. I wish I could give everybody with autism 3 sisters, 2 older and 1 younger. But the point is, I mean, here you'll see her in the bouncy boat wearing a life jacket, which has to be one of, at least for me, one of the least pleasant sensory experiences. And they got her in there, and she's happy. But it's not because they just plopped her in there. I mean, her mom started working when she was 2 to include her, but make it easier for her. And I remember her mother saying that she'd gone to McDonald's and laminated, they had a menu. She took a picture of the menu, laminated it, put pictures of the different things this girl would eat. And then she could point to what she wanted. And so she knew she would get French fries. She also knew she would get French fries right away, even if she had to wait longer for other things. And so they could take her to a restaurant, which before she couldn't have done. So it wasn't just that she was included, which was great, but it was that people worked to make things easier for her and then expected her to do it. And in the end, she was prom queen of her high school, which everyone was surprised by. And she did it, you know. She rode horses. I mean, she does all kinds of things. She still has autism. So this did not make the autism go away, but they could let her learn and take in information in a way that made sense to her. And I think that's what most of us here want to do. We want to help people learn, and then we need to make sure that they have opportunities for learning and carrying out what we teach them. Because I might be able to teach a kid to do something with me really well, but if he never gets to practice that in a supportive environment, what good is that? So today I'm talking about profound autism, and I'll say at the start that that name, profound autism, is not an end. I mean, I don't think it's a perfect name. It arose at the Lancet Commission. This just shows you all the names of the people in Lancet. So Lancet Commission was a group of people where the British journal wanted us to get together people from various countries and various disciplines to talk about the future of research in autism. And so we had people from 6 continents, 13 different disciplines. We were trying to get a variety of different people, several people who had autism themselves. And one of the things this group said was our first priority is urgency, because at least in the US, an extraordinary amount of money has gone into the biology of autism, which is really good, but it's probably not going to help the kids and certainly the adults who are here today. And so it's not that it's not helpful, but it's a long-term investment. And what about the people that are here? A second priority was that we know a lot of things, but we don't always use those things, certainly in the clinic, but even more so in communities. We don't make sure that things happen that we know should happen for autistic people. And I think what is down in the bottom that you can't see is the recognizing that neurodiversity and the diversity of autism is important. And we need to recognize, not just saying, no two autistic people are the same, but so what does that mean about what we do? So I think the consequences of this is that research does need to have priorities that are beyond basic science. I am not at all saying basic science isn't important, but the payoffs for basic science are going to be a long time from now. We also need to consider what we know about autism within cultures. And I can't tell you within a French culture or a Britain culture what you should be doing, but we need to be thinking about that. So what does that mean for where I live and where the kids that I see live? And we also need to remember that a lot of the things we know in autism or can learn in autism are relevant for other neurodevelopmental disorders. We get very focused on autism, but there are a lot of people who have overlapping issues. And the lines between what is autism and what is not autism are really quite arbitrary. We can draw them reliably. With something like an ADOS, I can say to you, I'll teach you how to do it, you do it the way I do it, and this is the score. But that is not real. That is just so we can communicate. The reality is things are much fuzzier. So what we proposed, and I'm not going to spend a lot of time on this, but just is the idea of stepped care. And that is the idea that you need to prioritize what you're doing. And then you need to figure out what are you going to do around what is most important to this family, and if you're dealing with an adult, that adult, instead of just doing what we ordinarily do. And that's quite different than ordinary medicine. So the point here, and let's see if, no, you can't tell. So the point here is that, for example, if you have a child and there are safety issues, if you're worried that a child is going to elope, run off, or if you're worried that a child is poking themselves in the ay, you have to worry about those things first. Then you need to worry about health. If you have a child who's having seizures, then you have to worry about what is most relevant for the child of this age and the circumstances in which they find themselves. Are they going to a school with other typical kids or not? And then what does the family want? What is the family capable of doing? Some families can just drop everything and organize themselves around an autistic child. Some families can't. And so how are we going to help them? And then, your steps then are what is easiest for this family and for this person. What did they want? Do you have somebody who comes in who says, I want medicine? Or do you have somebody who comes in and says, I don't want medication, I want a group, I want to talk to somebody? Or somebody who's like, I do not want to talk to somebody. So the point is trying to individualize what you're doing. So why do we need a concept of profound autism? And that was a concept that was suggested by the Lancet Commission, so that's why I brought them up. I think that we were all concerned that when you look at the research done in autism, almost all of it was done on verbal, and usually in the US at least, upper middle class white kids. Kids who can talk, or adults who can speak, who can give you consent so you're not worried about getting consent from somebody else, who can get themselves into a scanner or will let you take blood repeatedly. So that is who the research is about. I also think in the media, there's been so much more autism in the media, and much of it is probably useful, but mostly it's people who are like the good doctor, or I don't even know, what's her name? Amy Schumer's husband. It's people that have a lot of money and are very bright. And not everybody with autism is very bright. And certainly not everybody with autism has a lot of money. So the particular concern was what happens to people with autism who cannot speak for themselves, who can't be a self-advocate, and who need extensive care. And sometimes there are laws that are proposed by disability rights people. For example, I heard somebody say the only group besides pedophiles who can't live close to each other are, in some states, are autistic people, because there are laws against having 2 residences for autistic people within a mile of each other. And the logic there is they don't want ghettos. They don't want people forced into living together. But what about people who do want to live together? What about people who can function much better, for example, on a farm? And in order to run the farm, you need to have 20 people who live there. And the concern by primarily at this point parents was what happens to our kids as adults. So I think the focus was on individuals who have substantial intellectual disability and or very limited language, many of whom also have complex occurring difficulties like self-injury or epilepsy or sometimes aggressive behavior, although that's less common than you'd think. I think the proposal from the Lancet group was to begin to identify this group, not in early childhood, which I have really strong feelings about. I think you cannot identify these kids when they're really little, and it would not be good, but sometime in later childhood. And so I'm going to talk about how people have tried to do that. And just to show you how different research cohorts are, when we looked in 3 different groups for the Lancet and tried to define profound autism by IQ or language level, we found that the percent of the population of autistic people ranged from 18% to 48%. Particularly in low-income countries, which would not be France, the proportion of people identified with autism who have what we called profound autism is very high. But we forget that, I think, from more affluent countries where we're seeing many more cases of much more subtle autism. So partly we were trying to respond to DSM-5 having severity levels. And I can say, since I was on this committee, we hated these severity levels. We were told we had to have severity levels. And we were so worried that the severity would be used either to exclude people from services or to mean they couldn't get, like they're not severe enough, so they don't deserve support, or they're too severe and they shouldn't get support. And so this is almost nonsense, because we were trying to write something that wouldn't lose support for anybody. When people have studied these severity levels, they didn't work. They were not reliable from mothers to fathers to clinicians, and they weren't reliable over time. And so they don't work. And this is the point why. So we wanted a different word, and I could spend hours trying to defend profound autism, but I can say I put my foot down. We're not calling this severe autism, because I think there are people that are severely affected by autism who don't have intellectual deficits, who have other kinds of problems. And also, I think all of our severity goes up and down depending on the context. So I said, nope, we're not doing severe. And the only word we could come up with was profound. But maybe someone will come up with a better word. And if you have ideas, let me know. It's not intended as a different diagnosis. It's intended to draw attention to the fact that sometimes we start talking primarily about people that have much less severe, profound effects. So it's reminding people when they say, for example, everyone can have a full-time job and be paid regular wages, that there are some people where this is not an appropriate expectation. That's the point. I will talk about other definitions, but the point is mostly to draw attention to this group. So it's not saying it's a different diagnostic group. The other thing is this is not something that people have to have. You know, someone can say, I don't want that term used with my child, and that is fine. The point is we want to encourage people to think about it. So these are the 3 samples that we studied first. And MOBA is a study in Norway that saw 100,000 pregnant women and followed them. The kids are now, actually, some of the kids are 15 and 16 years old. So this is as close as possible to a full population sample. And of the kids who have autism in Norway, only about 18% met this criteria of profound autism. Sorry, I should say. So for the Lancet, again, the definition was IQ under 50, any IQ, so verbal, nonverbal, full scale. Or very limited language. So language, either single words or maybe memorized phrases, but very limited language. In the SNAP sample, which is a representative sample, theoretically, of kids in London, you'll see, if you look at the blue, the proportion was, I think, 23%, the proportion of autistic kids who met criteria for profound. And then I have a sample that was identified at age 2, 32 years ago. And of that sample, it's 48%. I don't think, part of it is who was being identified 30 years ago with autism, and that is our sample. The other interesting thing is the proportion of females in the group, and you can see actually the first one is females, the second one is males. So there were more females proportionately in this group than in the other groups. And part of this may be because we miss milder cases of autism, which you'll hear about a couple days from now in females, but also that females do survive some really difficult genetic conditions. Females are tougher, and they survive, and some of those kids will have autism. So it's probably both things. We also asked for the Lancet study, what about when could you diagnose this? And I think as a clinician, it just makes me really nervous to start diagnosing, saying to a family who's just walked in the door with a 2-year-old or 3-year-old, your child has profound autism. So what we did was we looked at when, if with the longitudinal samples, we could go backwards and say, if this kid, when could you diagnose it? And basically, it looks like you could diagnose in a SNAP sample at age 15. They're now 25. So they didn't have data before that. In our early diagnosis sample, you could actually diagnose this at 5. But I'm not sure that that's a great idea. And if we looked at 9, you could do a better job. So 92% of kids who would have fallen in this category at 9 still fell in this category as 30-year-olds. And actually, the kids that moved out are kids whose IQ went up 3 points. So I'm going to show you some videos just of different kids and as they grow up who have profound autism. I mean, this is what I'm talking about. So, okay, can you start the video? So this is one of the cutest but most autistic kids I've ever met at 19 months. And you'll see that he's having an ADOS. Those of you who know the ADOS, the examiner's blowing bubbles in his face. She's right there, and he just does not pay attention to her at all. Sitting behind him is his grandmother, and then his mom is in the back with his baby sister. There he finally noticed the bubbles. He looks at his grandmother. He looks like he's going to go to his sister, and then pew! He scoots over, and he's back. But what I wanted you to see here was finally he notices the bubbles. And the important thing there is it took him a while, but he did it. And he was also so aloof, so cute, but so aloof at that age. Here he is. I don't know if this video is going to work, but here he is at 9. We'll try it. Is it going to work? No? Okay, there he is at 9. At 9, he had rote language. He now loved people. He was very friendly, very happy, but clearly way behind developmentally. So more like a 3-year-old maybe. But with language, he could produce simple sentences. And then here he is at age 20. At 20, he lived with his grandparents, and basically he took care of them. The last time, when we saw him at 20, he had just learned to change sheets on a bed, and his grandmother had to make a calendar and circle the days he could change the sheets because he loved changing the sheets so much, he was changing their beds every night. He also brought us all drinks, and then when we put them down, he'd come take them away and put them in the dishwasher. So both some really nice skills, but also still autism in the sense that he had a definite idea. He had a job working down the street with a family friend where he helped in a bakery, not all day, but part of the day. And he really was very happy. And you can see now, this is a very odd task because what we're trying to do is the equivalent of blow bubbles for an older person. And so we're doing something weird, and I don't know if you can see it. You'll see his face. Go ahead with the video. Can you turn the sound up a little bit? Is that possible? Turn the sound up? No?
Should we do it again?
She just said, you want me to do it again? You couldn't see, but he just smiled at her, but like, what do you want from me? My point here is just that if you think about him at 19 months, with somebody blowing bubbles in his face that he doesn't even notice, here he's very aware that this woman is doing something really weird and is trying his best to do whatever she wants him to do. And he still has autism, but socially he's doing so well. Okay. Uh-oh. Okay. So we can follow the trajectories of different people in our study. This is a study where we saw 250 2-year-olds for possible autism, and we followed them ever since. And when we look at their changes in verbal IQ, what we see is there's one group where their verbal skills shoot up between 2 and 6, and then stay high. I mean, this is all relative to IQ, so it means they're still learning. Everybody here is learning. Where there also are groups who are much more delayed. And they stay delayed, even though they are making progress. This is a similar idea, but just looking at language scores from the Vineland, which is a parent report. But what's important here, the thickness of the line is how many people are in it. Along the bottom is their language level, is their actual age, and along the side are their ages in language skills. I want to make really 3 points. One is at 2, even though that looks very different, it's not. Those kids are basically almost no one is talking or talking very much. So you really cannot predict where language is going from kids who are early 2-year-olds. If they can talk, great. That's good. That you can predict. But if they're not, it doesn't mean much. But what happens is you see really nice progress where things are zooming up for a certain proportion of the kids between 2 and 5. So massive catch up. And then things become more straight. It's not that people aren't continuing to learn. They are moving up. But if they were learning very slowly, at 5, the likelihood is they're going to continue to learn language very slowly. Probably many of us know miracle kids, 1 or 2, that have shot up later. But mostly it doesn't happen. So this is one reason we need to be very careful not to overdiagnose profound autism at very young ages, I think, because we don't know, but we also need early intervention. This is just about using IQs from early years, and the point here is for kids over here on the right who had very, very low IQs at 2, the green is pretty much all of them continued to have severe or profound intellectual disability. But you see that kids who had IQs between 30 and 50, there's a variability, and you start getting between 50 and 70, and look at all those different colors. They could end up anywhere. So again, we need to be careful about making pronouncements from early ages. Maybe things are better now, because this was from kids who were 30 years ago. But I think we just have to be careful about development. So now I'm going to talk about a paper about stigma and profound autism that's by Elaine Clark and Hilary Schultz. And I mostly just look at the red. So the point here is that we know there is stigma associated with being autistic, and there is stigma, certainly we've heard a lot from various people about stigma associated with profound autism. And is this going to be bad for people? And I think our concern was that it isn't the profound autism that's bad, it's the perception that this is a bad thing. And also that people don't have enough knowledge of autism. So they expect an autistic savant, a brilliant person, or that everybody's going to be Temple Grandin. And Temple is an amazing person on her own, autistic or not. She is a really unusual person who also had tons of resources and help and found her niche. So we can't compare everybody and say anybody who's not her is bad. So we need to know better, and we need to help people understand there are kids with autism who really can't talk or who can't convey how they feel. The other concern we heard from parents is that there just aren't enough services, particularly for adults. That there is limited support for where are they going to live, what can they do, and health care. Doctors that understand what's going on in an adult with autism. There's frustration about just even getting a hold of the people that are good at this. And that there just aren't enough staff. I mean, maybe things are better here, but in the United States, the staff that work with adults with autism are often paid less than you would pay someone to clean your house. And so it is a big problem to keep people in those jobs. So this group of people were then commissioned by Autism Science Foundation to see what we could do about finding better ways of defining profound autism. And part of a concern was that we had used IQ before, and the reason we used IQ was because IQ is in a lot of data sets. You can also track down IQ in the United States. In order to get Social Security, you have to prove that you have a very low IQ. So then you can look at the healthcare records. And so it's in records. These other things aren't necessarily in records. And I don't know about France. You will have to do this in a way that works for you. So we wanted to see what we could do without using IQ. And so we asked a variety of questions of the families that we knew, first from the longitudinal study, the study of the 250 people who are now in their 30s. So we asked their parents, actually we asked parents because we're talking about profound autism here. And the adults you could not ask them these questions. We then, once we got some results, which I'll show you in a minute, we did the same thing for patients that we'd seen at UCLA. So we asked, can the person be in an ordinary space for an hour and be safe? Would you worry to leave someone in your kitchen or leave someone in a house that's not locked up in some way? Can the person, if something happened to them or there was a fire, could they tell a stranger what happened? Enough so that someone could help them. So those were the two main questions. And then we asked them, can they do their hygiene? Does someone need to get in the shower with them? Does someone need to touch them in terms of dressing them? Because that just adds a risk. And it also means certain people can't or won't do it. And then we asked them, can the person manage money? Not that they're making their own money, but if they have money, can they pay bills? Can they pay rent? Or can they go to the grocery store with a certain amount of money and an expectation? Beyond that, we asked, can the person get from place to place on their own? And this could be taking an Uber. Do you have Uber? Yeah, no? Anyway, it could be taking a taxi, but can they do that? No, they don't have to drive themselves. And could they stay routinely by themselves overnight? So using those questions, we first talked to a group of parents about what they were most concerned about. And what they said was safety without supervision, that they felt like they could not leave their kids or young adults alone. And then the ability to take care of basic hygiene. And part of it is just, what would my son do if I wasn't there? I can't leave him in the bathroom with toilet paper because he will use the whole roll. So what happens if I'm not there to give him the toilet paper that he needs? Or to turn off the shower or set the heat in the shower? We could find good agreement on that. And then people also did propose managing money, getting places, and staying overnight. But there is a huge middle, and this is just a problem, so I'm not trying to convince you anything about the middle. So when we looked at groups formed by those first questions of not safe by themselves and could not communicate what's wrong, so that would go in the profound group. Then we had the high group, which was can manage money and transportation and all physical dressing and hygiene. And that would go in the blue group, which we're trying to be careful not to say no support, because people might need support getting a job, for example, or keeping a job. And then you get the middle. And this matches up. The question is, how much did it match up with the Lancet? And it matched well with Profound, less with the Lancet High, which is just high IQ. So there are people with high IQs who still do need some support. And then in the middle, you can see it's chaos. So my point is just, this is a process. It's not an ending. Okay, whoops. Oh, sorry, I have arrows. So this is looking at autism characteristics, and this is just ADOS scores. All you need to know, the ADOS is a 45-minute clinician-administered series of tasks that you do with someone to get a diagnosis of autism. It's only in 45 minutes, and it's with a skilled clinician. So this is not a lifetime severity. This is the severity of that 45 minutes. So what you can see is that people with profound autism had higher scores, which you would expect. That's over on the left for social communication, and then the two other groups. Okay, remember there's that group in the middle, which is huge, and then the group of support needed. Then if you look at repetitive behavior, that's what RRBs are. Again, 1 to 10. 10 would be tons of repetitive behavior in the 45 minutes, and 5 would be a little bit, and you can see there's actually no difference. There are differences in what people do, but not how much in our groups. So my point is, this is why I really did not want to say severe, because I think the repetitive behaviors in this group, there are some people who are severe who are very smart. And there are other people who are severe who cannot talk and are functioning at a very low level. This looks at the Vineland, which is a parent report measure of daily living skills and adaptive skills. So it is looking at, can you take a bus? Can you wash yourself? Do you pick out your clothes? Would you know what to wear in the rain? And you'll see that the profound autism people in our group, with our questions, came out very low. That's on the left. And then there's quite a range that doesn't overlap with profound autism, but over on the right of the most able group, but a big range. And then it overlaps. The one in the middle overlaps with everybody. So we have not figured out what to do about them. And then this is behavior problems defined by me. Problems of behavior that I don't like irritability, hyperactivity, and what you can see, actually, I think that is irritability on the left and hyperactivity. And these are parent reports, and you can see that on the whole, they're not very different. The people on the right are slightly lower, but they're not, you could not put people in a group by these things. So my point is, all those other things that go with autism might not travel with these categories. So I think the point of this all is that you can identify people that are not safe, either because they could not tell someone if they were left by themselves if something happened, and they might hurt themselves for whatever reason by turning on the stove or getting in hot water or not understanding how to wash a knife. Generally, the adaptive and IQ assessments distinguish the very low group and the very high group, but there's a middle group. So they don't work well there, and it may be better to just ask practical questions. On the whole, the the least affected group and the middle group were primarily distinguished by repetitive behaviors and then externalizing symptoms. And that's something that we found, which is not surprising to anybody. Other people have found it, that people who have autism, who do things that disrupt other people's lives, like hitting someone or scattering food, things, or doing challenging behaviors, do get in more trouble and are more limited by the society. On the whole, the difference between the most affected group, the profound group, and the substantial support group was in the ability to communicate, which is not surprising because we're asking about could somebody say what they're thinking, and language level. I want to add that we tried to do this then for adolescents, and it doesn't work at all. And for children, it's hopeless, because how many of us are going to leave an 8-year-old home alone for a long period of time, or overnight? We hope the 8-year-olds can take a bath by themselves, but most people have some alertness of what's going on. So we would need different ways to characterize kids if we're trying to pick out this group. Okay. Oops. So I just wanted to end with, we asked parents, what was most important to you? Who helped the most? Or what helped the most at different times in your child's life? And this is the longitudinal study. So more than half of these kids are quite impaired, but the people, about 40%, have average intelligence and are very smart. So what I want you to see is the red line are people. So when we asked families what helped the most, they identified human beings, people, who helped them, much less than a particular service. So rather than saying, what helped me the most was ESDM or Jasper or ABA, they said, Joyce helped me the most. And I think that's something that's really important for us all to remember, is we're people, and we want people to put us in this box. And that was true both for the autistic people talking for themselves, people who can talk for themselves, and across the IQ range. We also saw that having things that services, which is the blue line that goes down, helped the most for our families in preschool, is what they reported. Then in the middle school, but I think partly our families take school for granted and so are frustrated when it's not perfect, which mostly it isn't. And then as an adulthood, it was so hard to find services. So hard that is not major. But what is different is the other darker blue line, which you can't tell is darker blue, is going up, was particular activities that their kids got involved in that they loved. And that could be anything. I'm going to show you an example. Actually, I'll just skip that. This is just to put a plug in here, where this is the divorce rate of families with autism. And I have a slight tangent here, but you'll see that the divorce rate is highest for parents of very young kids. I don't know if that would be true in France, so something to think about. But I think we need to be aware when we see families of 3-year-olds that they are at the highest risk ever for divorces because it's hard and they're dealing with a lot. The other interesting thing is that does go down, except it goes up again at around 10 and at teenage years. And do you know who this is for? Families with very able kids. It's not families with kids with profound autism. It's families with verbal, skilled children. And I think they're hard, knowing what to do, knowing just what's right. I mean, figuring it out, I don't know half the time. Where should the kid be? How do we help him or her? And that, I think, is hard on families. All right, I'm going to end with just showing you two different more kids with, I keep calling them kids even though they are 32 years old, but he's a kid here. See what you think of this little guy. Can you start? So he was so cute and so happy. And when we first met him, we were like, how can this be autism? But there were a lot of things. He had all sorts of repetitive behaviors, and he wasn't real reciprocal. It was just that he was so cute. We were reciprocal around him. But I want you to see him at 30 because he's still cute. And what's interesting here is we saw him at 26. And we've known him forever, and we knew he can talk. And at 26, he would not talk to my research assistants, who were young women. And we were like, uh-oh, what's the matter? Is he depressed? His mother's like, he talks, but we could not do anything. And he was just about climbing under the table to get away from them. So we went back. And I think he was just shy, having these young women come into his house. And so you'll see. Start the video, please.
Take my picture.
Oh, he said, take my picture.
He is kind of taking your picture. That is a big, should we smile together? It looks great.
So he's another person who does not have a high IQ. We can start. Who does not have a high IQ, but has a good life. And what we worry about is his parents are nearing 70 years old. He is very happy where he is. And where is he going to go? He doesn't have siblings. But he has a job that he goes to for some hours of the day, not all day. He helps around the house. He cooks some. His parents have helped him maximize what he can do, and he is very proud of himself. Now, this is another boy I want you to see. Can you start the video? You'll see he knows what he wants. He is not going to let go of her. So he was a boy who was not that different. I mean, not so happy as the one before, but not that different in test scores than the other boy. Okay. This is him at 25. So he is very overweight, which is a huge issue in our sample. I don't know if it is here, but we can watch these people just get fatter and fatter, and we all get fatter and fatter. But it is particularly if they're on antipsychotic medications. When we saw him 4 years before, we were trying to get him to cheer when he was playing this game, which is like soccer with a ping pong ball, but he wouldn't do it. But what's really nice, and you'll see here, he has learned to do that. We didn't teach him.
Score! Can I try? Oh, so close.
And he also bent down and got that ball, which he wouldn't have done 4 years ago. And I don't think his mother had been practicing this for the last 4 years. The other important thing about him is that he had 2 new activities that his mother was really impressed with, that he totally came up with. And one of them was taking a chair out to the backyard with a little desk, a pitcher of water and a glass, and he would sit there and watch the birds. And that was totally his. It was his idea. He did it. No one was telling him to do it. And he seemed to really like it. And the other thing was that he had discovered that there were pictures, old family pictures, in a drawer in their living room. And he would take them all out and line them up on the table and then flap, but sort of shout and sing with happiness to see these people. And he loved his mother coming and saying, "That's your little sister, that's your grandma." And again, from him. So I think what we are interested in is, can we help families generate more activities like that people can enjoy, even if they are functioning at a very simple level? And can we help them help their adults find those activities? So this is just our way of summarizing. We think that the standard expectations for what is a good outcome, I'm almost done. Thank you. I'm almost done, you guys. The standard expectations for what is a good outcome for an adult do not work with people with profound autism. And it's really inappropriate to say they don't have a full-time job that's paid. So what we did was take the World Health Organization system, which involves social context. So everybody, all the blue tiles down there on the left, blue means somebody has a friend. And a friend is defined as someone that you see regularly, that is not paid to work with you and not related to you, but whom you enjoy. So you can see about half of our sample who have limited intellectual ability had a friend. We said daily living skills, we set the bar at age 8, which means all hygiene you can do yourself and some chores around the house. And again, there it's a little bit less than half. And then current activities, you'll see blue is some kind of employment, could be supported or not. Green is voluntary work. The sort of beige is going to a special center, and more than half of our sample is doing nothing. They are at home. And part of it is they're rural. Many of these families live out in the country, so it's hard to get places. But when we combined this, so we took people that had 3, all blue, that's over on the left in the big tiles. The people that had nothing are the orange. And this is our job, you guys, is to fix this, because this does not have to be. And this is why parents of profoundly autistic people are trying to urge us to pay attention to them, because they are getting lost in this system, and they don't have to. So I think there's a study going on right now, actually it's just finished, collecting data, where people were asked all over the world about what they thought profound autism should be. And they were asked questions about all these things. I'm going to just show you, they were supposed to say, is this true or not? And so there were various people saying, maybe you could raise it to 70 or 90, oh my God, or various statements. I'm just going to show you a few of these, but okay. So this was circulated. And then what this group, I'm trying to stay out of it just because I was so much in the middle of it before. I feel like other people should do this, and they shouldn't be worried about offending me. That's just the divorces. But the point is, this is going on, and someone fairly soon will write up a paper about everybody's consensus, and maybe they can come up with better things we can do. There is just a trade-off between what do you do in your clinic particularly what is a psychiatrist or someone who doesn't give IQ tests going to do, versus how do we use records, which is going to have different results. And that's hard. I think the other point here is the size of the circle over time just shows the level of importance of different circumstances. So for a young child, their parents and their family is going to make more of a difference than anything else. For an adult, ideally, the community and their functioning and other adults would make more of a difference than their family. But that is not true, again, for much of our sample. So So coming back to this, if you look here in terms of what are the needs and where can people get help, it is different than a standard medical system where you say, come back and see your psychiatrist more often. The psychiatrist does not want to worry about how do you get on a bus. I think I like this drawing because it just suggests that people are on different trajectories. And actually, Giacomo will talk about this on Thursday. But the idea that you start off, and if you don't learn to talk, your life is going to be different. First, we're going to try to get everybody to talk. And then if that isn't working, we're going to shift gears, or we should shift gears, so that you're not spending all day writing your name when you're 14 and you can't talk. So we need to figure this out. A child who's very, very hyperactive may need a different environment than a child who is very actually sedate and passive. And so thinking through those alternatives. And then the last thing I put, and this is from the Lancet paper, a slide by Andrew Pickles, who's our statistician, is the idea that no matter where you are, whether you have profound autism or you are very, very bright and capable with lots of resources, and that's the extremes here with the middle, if we raise the bar in terms of services, not in terms of expectations, if we help you more, everybody will get moved up. We can do that. And I think the idea is just today or tonight, get you to think about that. And to think about that within your own culture, because you have supports here in France we don't have in the US. But you also have a different culture. And so how can you do this and make sure that everybody gets the attention and the support they need? So this is a family sent me. This is a Christmas card once. 2 of the boys have autism. But I think the other point is that autism is not, you don't add it up and this is what you've got. You know, you put this all together with all the other parts of your personality and your strengths and your weaknesses. And one strength, if you think about the one boy, was he was so neat that changing sheets was really fun for him, which it might not have been for somebody else. You know, you think of that other boy who was such a charmer, and they could put him in the front of a store, and he would smile and go get somebody's laundry. Do much better job than me, where I would be grumpy. So we want to figure that out. And those things, I think, are just as important as autism, even though autism plays a role. The work that I've talked about has been done by far more people than this. We especially need to thank those families and these now 32-year-olds who have put up with us for all these years. And sometimes we come with chicken, some fried chicken. Sometimes we come, they're like, why didn't you bring the chicken? Sometimes we come with, I don't know, all kinds of things. And sometimes families make Thanksgiving dinner for us at 10 in the morning, you know, in May. But they have done it, and we wouldn't know these things without their participation. And then funding agencies who made this possible. So thank you very much, and thanks for staying here, you guys, an extra 10 minutes. Okay, that's just in case anyone asked me first.
data. Thanks.
Des questions?
Any questions from the floor? Please introduce yourself and your function.
Semel, I am a parent of a young boy. I would like to know your reaction because I read in the Lancet a few months ago a tribune made by autistic auto-representants who argument against profound autism. Could you tell us what do you think about their arguments?
I mean, you might hear about it tomorrow. No, I think I feel very bad. I feel sad about it because I do work with a lot of autistic adults who are not profoundly autistic. And most of them are not against it. But I think there are some people who are very vocal about being against it. I don't think it's perfect. So, I mean, as you saw, you know, there are a lot of imperfections. I think the word profound is not perfect, but we couldn't find another word. So we are waiting for a word. I think that the need to recognize that there are truly people who cannot do the things that most self-advocates can do is really important. And I do think people just forget. I mean, I'm on a state commission with disability rights, and people get going on everybody should be in a regular school, in a regular classroom. And I don't think that's true. I think, what do you think they're going to get from a regular classroom if their understanding of language is at a 2-year-old level and they're in a 12-year-old class? I mean, I think that's wrong. I also think that having everybody have to have a job, a full-time job, and expect that they're getting paid at a regular rate is not possible. I think many people with autism can work and can make a really valuable contribution to different places. But I think that doesn't mean everybody can, and it doesn't mean full-time necessarily. And so I think we have to be very careful. And I don't quite know, I mean, I think, Christina, Dr. Nicolaitis could talk about it more. I feel like it is really sad that we cannot be a whole autism community together, working together to accomplish the same things. That includes everybody. I also don't think that most self-advocates know anything about the people that I was talking about tonight. I mean, I was on a meeting, I just couldn't believe this, where somebody said, you know, we were talking about someone who could not speak for themselves, and they were like, well, get them an AAC device. Do you have an AAC? Like, I mean, AAC devices sometimes miraculously work, but not for everybody. Not for everybody. That is ridiculous. And if you've ever worked with someone who is functioning at a level of a much younger child, you know, but I think, so I feel bad about that. It just makes me sad because I don't want to argue, particularly not with autistic people or people who work with autistic people. And I think some of the vehemence and the horrible things that have been said to parents by autism self-advocates is appalling. And I think it's partly that people don't know. They don't know how awful, how painful they're being. And that's really sad. So it's too bad. But I also think this is not done. I mean, I'm not trying to say to you, you know, go get cement and have profound autism, and but I think the recognition that some people need different help and a lot more help. I mean, a friend of mine runs a program for autistic women, and she was saying that it was supposed to be for verbal autistic women. And initially it was for the woman who started it, who is an autistic woman, who graduated from college and has a lot of resources, so wanted to give money. And it was originally for people just like her. They've then added women who are not as bright and not as capable, but who are still can talk. But they have different needs because they are not working. They're mostly not in relationships, and they need help with, not with getting dressed or things, but they need help in finding a place in this world. Whereas the women she started with, were people who could do lots of things, and were often frustrated and angry about how they'd been treated, but they did not need help in, like, how do you take a bus or a metro or things. And then also the people she started with had known they had autism since they were very young, and so didn't particularly want to talk about autism. And now there's a third group of women who have new diagnoses, and they want to talk about autism. And she was saying, we have to have 3 floors in this building for the 3 different groups, because the women who want to talk about autism make the women who have been autistic for years like, why would I talk about this? And the women who have basic needs have very different needs. So I think that we need a place for everybody. And we need a place, if you want to talk about autism, that is important, but not everybody does. I mean, our longitudinal study, we've known them. They've seen us coming around about autism for 32 years, and they mostly do not want to talk about autism. They've had it, but that is very different than someone who just got a diagnosis. And then I think this is not something to be proprietary about, I don't think, but it's hard. It's hard. So, good point. Everyone should read that, because you should know what people are saying. That's a very long answer. I'm sorry at this hour.
Any other questions, please?
I think there's one in...
Hello, my name is Gregory. It's a pleasure to meet you. I'm a self-representative, and I mostly agree with the need for the profound autism separate administrative diagnosis. But I'm quite scared to have it in France, especially in France. As you wrote it earlier in your slides, we had the Spanish and the French word, which is quite inappropriate. Here we have, unfortunately, the psychoanalysis, where we can hear some stuff like neurodevelopmental disorders do not exist, where we pulled the mistake of having an autistic child on the mother. So it's the mother mistake for being a mother sometimes. You said it with the divorce rates earlier. And here I'm also part of the French National Advisory Council for People with Disabilities, where we regularly talk with the government about school, about scholar needs. We are in a quite bad state about a bad situation about that. Like we have the Creton law, l'amendement Creton in French, where we have people still in specialized educative and medical institutes, les IME, that are stuck above the age limit, which is quite around the 20s. And I'm afraid that having separate profound autism diagnosis will be misused to give help to people that have special needs, like you told, and to especially counterbalance the needs for adults which need substantial support. So we are in a situation where it's really hard in France to have some support when you're in adulthood, when you can talk, especially the talk. When you can talk, it's really hard. And giving the government a way to say, okay, we need to support profound autism now, because and I'm pretty sure they won't really understand the administrative side of the diagnosis, will help them to cut what they did for what they try to do for the adulthood, which is taking too much time to be in place, and just to rebalance that against the lower part of the spectrum. I'm not sure if you understand me. Yes.
I do.
And I wonder if in France, especially, this is a good idea to have these separate diagnoses, and not so separate, but okay. Thank you.
I mean, I think those are reasonable questions. You know, I guess I feel like we shouldn't think about it as there's a pot of money for autism, and if more money goes to help the people, you know, if people who need more support get more support, other people won't get it. I mean, I think we need to fight that, but it's a realistic fear. I think people have said that about autism compared to intellectual disabilities for years. They've said, why is there such a fuss about autism when there are all these other people who have neurodevelopmental disorders who also need similar supports, which is absolutely true. But I don't think the fact that the autistic people got support is bad. I think we just need to get everybody support. So I would say we need to be very careful that doesn't happen, because that is not the intention. And I mean, today I just talked about profound autism because that's what was asked of me, but there are lots of autistic people who need other things, and they do need them, and we need more services, especially for adults. So that's true for everybody, and we need to figure out ways of having more support. So I completely agree with you, but I would hope that we could do this together. And I do think that it would be better if we did it as a united front of this is autism, and we need all kinds of support, because we know it's a very different, it's a spectrum, and don't forget that. But at least get people away from the idea that all autistic people are secretly very, very smart, which is just not true. But those people have skills and strengths if we can bring them out. So it's a good point, though. And the word, I don't know. I don't know what to do. I mean, I wished we could name it after somebody. I mean, Mary's autism and Joe's, I don't know. I don't know what to do, because the word is not perfect. And I especially don't know that outside of English, but even in English, it's not great. But saying with substantial support needs does not work. I mean, I think if you look at, for example, ICD-11, you have autism with intellectual disabilities and specific language disabilities. Nobody in the US uses that. We're in too big a hurry. So we need something short, but I don't know what it should be. So if you get ideas, let me know. I will promise to spread them.
Thank you. Another questions? Okay, not for me. So.
Good evening.
Hi.
I'm Isabel. I'm a speech language therapist. And And I work with 9-year-old children with profound autism. And is there a hope for them to speak? Because parents ask me every day, would we be able to talk one day?
I think if there is the chances of them speaking fluently, if they are not using their own sentences, like sentences that they put together, so not just something they've memorized, is very low. It's not impossible. I mean, there are people who, we discover they can type, or we discover particular things, but the probability is very low. So I think, though, what you can do, I bet you do, is you take every little thing they can do and you enlarge that. So if they have gestures, you teach them more gestures. If they've got a few words, you teach them to use those words in different situations. If they can recognize pictures, you teach them, you just say, how do I get them to communicate what I want? Or, sorry, not what I want, what they want. Yeah. Sorry, what I want meaning they want. So I think, there's a lot that they can learn. And I think even, the very last young man, who IQ-wise is very, very low, he did, it seems minor, but the fact that he just picked up something that was dropped at age 26, and he wouldn't have, at 21, we could have poured everything on the floor, and it would never have occurred to him to pick it up. So he is learning things that actually have practical value, and he was very happy to play that game. So there are improvements, but it's hoping for fluent speech. It's not impossible, but the percent is so low.
Thank you.
Well, I have my grandson is 15. Okay, get it in the English channel. If you're... the interpreter is doing the job. Okay, we're ready? Yeah, good. My grandson is 15. And according to what you said tonight, fully corresponds to the profile you presented. And I would like to thank you really from the bottom of my heart, because the subtitle of your conference is The Forgotten Ones from Research. And this type of profile, his profile, is one of the lost ones out of the radar. And what you brought us tonight, whatever the difficulty of speaking, does show that hope on the whole life trajectory is extraordinary, and that these people have a capacity and that they have skills that you have to go dive deep to get them, functional skills. And the strength of your intervention tonight is to show us what are one of the ways that are most important that we need to develop in research. I just wanted to say that because really you brought us a lot. Thank you. Hello, I am Irene Faure. I am a psychiatrist, a physician, and I'm going to speak French as well so that it's clear for me. I hope it's clear for you too. You insisted several times on the fact that we shouldn't put too early diagnosis in very young children, especially with profound autism, but it is recommended to have early diagnosis to improve the trajectory of these children. So we can, get a way out of that we go along before we need to put a diagnosis. But I would like you to give us sort of a reasonable cutoff point age when we work with these children with autism. Thank you.
Really wasn't clear. I think you can diagnose autism as early as 2, sometimes even earlier, although I think you have to be careful because there are kids who look pretty autistic at 18 months and don't at 3. But I think you can diagnose autism, and then I think you do need to know cognitive level. So you should know non-verbally, what can this child do? Even a 2-year-old, can they do non-verbal things like other 2-year-olds? And then what is their receptive language like? Because often parents think it's pretty good when it may not be. They may be very good at communicating to their child, but not understand what their child doesn't get from the rest of the world. And then what is their speech like? So I think you can do that. I just think saying this child is going to be profoundly affected their whole lives isn't appropriate. I would like to wait till at least 8 years old. I think that some of the parents that we work with of profoundly affected kids would like it to be younger, at 5 or even younger. And you probably could, statistically, with our sample, the sample we've been following, you could say at 5. We were 86% accurate. But I just worry, I don't want to underestimate kids. That's what I would hate to do. So I think there might be some kids you would be very clear. I also worry about our schools. I don't know if this is an issue here. But in the US, I think people keep trying to push academics for kids who cognitively, at 8, for example, are functioning at a 2-year-old level. And it's worth checking that they can read. Maybe they can. There are some kids who can read who don't talk. But if they can't learn the alphabet, after 4 years, I think it's time to do something else. You could come back if you want later, but why not have them do something that helps them, that is interesting to them, and that moves them forward? And I think that's hard to do because we don't even think about that. Like, what should an 8-year-old who is functioning at a 2-year-old level be doing in school? But it can be done. And that's one of the reasons I think the parents have pushed it, is saying, why didn't someone help us, for example, teach our child how to bathe themselves, or teach our child how to get a drink from a carton and pour it in a container and not spill it? What practical things, instead of working on their, adding, 2 and 6 when the child can't count. Well, they can rote count, but doesn't understand that 3 is more than 1. So I think that's part of the pressure. But I'm not saying don't diagnose kids early. I'm saying don't say they're profound. That's what I'm saying. So sorry, because that was confusing. You guys, I'm going to keep you here all night.
No other questions, please?
Oh, there's one back there.
Well,
Way back there. This poor guy. There. There.
that. Oh, sorry.
Good evening, my name is Gwenelle. I'm a head of nurse. Thank you for your intervention. I'm working for a structure which takes care of children with sensorial deficiencies, deaf or blind. And we are welcoming from several years now, children profoundly non-communicative autistic, blind or deaf or sometimes both, which is increasing certainly their difficulties. And once the diagnosis is given, it's quite difficult for the staff to know where we should start, what actions to start with regarding these children. So I would like to know what your recommendations would be, both for the staff taking care on daily basis with these children, and for the medical board and administration board of this structure regarding the priorities in the care given to these children and to their caregivers.
Oh my goodness. I think it's really good you're doing this. So I think there are very few things that are harder than what you're trying to do. I think that I would, in terms of priorities, I would think first about the things we talked about, like safety. You know, what does the environment need to look like so this child is safe? And then I would think about communication. How can this child communicate if they can't hear, or if they can't see, or they can't both, which is very, very hard. But I think that then I would think I would use, what is this child doing now to communicate already? Like, are they making sounds? Are they reaching? Are they grabbing? Are they touching? Are they mobile enough to bring objects? What are they doing? And I would look at whatever strategy allows that child to communicate. I think I would also try to think about, how do I help this child move through space? Because I think they need exercise and they need to move and it needs to be fun. And how do you do that? And that is something I've seen in a program I used to work with for deaf autistic kids. They had a wonderful program for getting the kids to play games, that were geared toward, you can't hear, but you can see. And how do I teach you to run from here to there? How do I teach you to go faster? How do I teach you to go slower? How do I teach you to look at the child next to you? All of those things you can do with a deaf child. For a blind child, I know less about it, but I think you would want to think about the same thing. How do I help them be able to go from place to place and also move in a way that feels good? Because one of the biggest risks is just people get so sedentary. I don't think there's a simple solution. I think that I don't think you can prioritize like hearing, sight, autism. But I think what you can say is, if this child is autistic, there's some things that, for example, repetition really helps in general. Structure helps, that is breaking things down into small pieces. Having routines helps. So even learning, I'm going to go work from left to right no matter what I do. If I'm making a sandwich or I'm folding clothes or I'm writing, I'm going to go left to right. If there's a container, I can open it, but then I'm going to need to put something in it and close it. So those kinds of routines, I think for any of those kids help. And also autistic kids help. So I think giving multimodal information for whatever modes they can take in also can help. So the idea of, if I have boxes of things to play with, the boxes can feel different. They can smell different. They can, if I can see, they can be different colors. How do I make it as easy as possible for this child to do different things? But it's very hard. You have a very hard job, but it's so good. And we can all, well, this is, I'm defeating everything I said today, but you can think of Helen Keller, but you can think of somebody who's got written off, who actually could do an amazing thing. So I think you don't want to hope that everyone is Helen Keller. Well, we can all hope, but you don't want to think they're Helen Keller, but you want to go step by step. But how do I communicate? And what is important to this child? I think I learned this from, when I was a student, I was doing ABA with a child who I had to get him to say bah. And I was supposed to work an hour a day to get him to say bah. And he did not say bah in an entire year. It was excruciating for both of us. But what I did do, and now I look back on it and think I was more intelligent than I thought I was he loved water. And so we went to the bathroom every 10 minutes, and he washed his hands, and he learned to wash his hands with soap. And then he learned to dry his hands. And that was the thing that we both looked forward to, was running down the hall to the bathroom. But I think I could use the fact that I discovered he loved water. And that was something that I could do. I could have taught him to wash his hair. I mean, it was... So I think that kind of strategy may make more of a difference. What means something to this child, and what's important to them, and what would they want to communicate, and then how can I back up and make that simpler in littler steps? I hope that helps a little, and good luck. Okay.
Donc on va s'arrêter sur cette dernière question. Je vous rappelle que Catherine Laure nous fait le plaisir de nous se mettre à disposition pendant la session de rencontre avec les experts. Donc vous pourrez poser toutes les questions qu'on n'a pas pu aborder ce soir, vu l'heure tardive. Merci à tous.